Gynecology is the care of women, but it's more than your annual exam. It is also addressing issues that start with puberty, whether it's a delayed period, frequent period, heavy period, painful cramps, young adulthood, and throughout your life until menopause. We want to address contraception, what your family planning needs are, whether you're having problems with pelvic pain or abnormal bleeding, whether you have hormonal concerns. It's just the overall management of women. But throughout life, it's important to have a good relationship with your gynecologist. As far as surgery goes, we may need to address endometriosis or fibroids. With Da Vinci laparoscopy, we may be doing in-office procedures to remove polyps or to treat heavy bleeding. We may be doing gynecologic aesthetic procedures to help address urinary incontinence and pelvic floor issues, addressing your hormones with hormone pellets. The length of time needed for procedures varies by procedure. So some of our more minimally invasive surgery, such as Da Vinci robotic hysterectomies, can be as much as 90 minutes, occasionally longer, whereas our in-office procedures can be as short as 15 minutes or up to an hour and a half for some of our lengthier procedures. So there's many times in surgery or just with procedures that will combine techniques. And so if I'm taking somebody to surgery, I want to make sure that I'm going to do everything I can while I'm there. So if I'm taking care of your endometriosis with Da Vinci laparoscopy and you also have heavy bleeding, then I want to go ahead and discuss removing a polyp or taking care of a fibroid or doing an endometrial ablation. Our goal in our office is always to identify any needs you have, whether you have identified them yourself, and then just help you make a comprehensive plan. For any patient seeking our practice to entrust their care for a procedure, I would encourage you to come prepared with your list of questions. Our goal is to make sure this is collaborative to ensure the best possible outcome for you and to set your expectations for both intraoperatively and post-procedurally so that you know what your recovery will entail and how you will ultimately reap those benefits.